Hi, I'm Valentin from Canon Medical Systems. MRI is complex, but simple explanations behind the latest MRI methods are always good to know. To explore the brain in 3D with a high resolution and in a short scan time has always been a challenge. Today, let's talk about how to do this with the MPRAGE technique for 2 minutes. Several techniques have been developed over the years to accelerate the scan time, and each of them has their own pros and cons. One of these historical techniques is the fast field echo sequence, rapidly acquiring gradient echoes obtained at short echo time and with a small flip angle for the RF pulses. Combining this sequence with the pre-pulse before the imaging readout prepares the magnetization to control the image weighting or contrast. This implementation, called Magnetization Prepared Rapid Gradient Echo or MPRAGE, benefits from a high SNR and is particularly suitable for neuro-imaging because of its strong native contrast between white and gray matter. Recently, the sequence has been tweaked with a different inversion time Ti, which is the delay between the inversion pulse and the imaging readout. This new approach, called white matter nulled, is especially optimized to improve the visualization of the gray matter and the basal ganglia. Finally, the MPRAGE sequence has been further optimized to have a second readout using a different flip angle. This implementation is called MP2RAGE. While the first readout, spaced from the inversion pulse by Ti1, will lead to a T1 weighted image, the second readout, spaced from the inversion pulse by Ti2, will lead to a proton density image. Both images are then mathematically combined to generate two outputs: a synthetic T1 weighted image with a superior gray to white matter contrast compared to the MPRAGE, and a T1 map used for T1 quantification. This MP2RAGE technique is mostly used for brain and spine imaging to study the T1 relaxation of their components, bringing important information to diagnose and monitor neurodegenerative diseases. If you want more information about the MPRAGE benefits in clinical practice, click on the link and download the attached Good to Know document. You will find additional information, answers to some questions from the field, user tricks and best practices. And if you like this video, hit subscribe to stay tuned for more simple explanations that are good to know.